Today's video about the role of DHEA in muscle hypertrophy. It is part 5 in this area of increasing strength and mass of muscles. So it is DHEA. It is a very interesting substance, very promising supplement, I believe. DHEA is a steroid hormone precursor, not hormone, but precursor of hormone. It is officially admitted that it is a hormone precursor and primarily produced by the adrenal gland. After oral administration, DHEA is largely absorbed and converted to DHEA sulfate. DHEA sulfate is hydrophilic, DHEA hydrophobic. So difference. In the healthy adults, DHEA sulfate levels decline to 10 to 20% of the level peak by age of the peak levels by age 70 years old. Oral DHEA supplementation increased circulating DHEA sulfate, actually, because DHEA itself, it is hydrophobic, but what is measured in the blood, it is DHEA sulfate levels. Okay, it is increasing well above the baseline in the middle age group. Producers advertised that intake of DHEA before the workout may help to build muscles or maintain muscle mass while burning body fat. DHEA increases the production of collagen, making skin appear smoother and younger. So we have here DHEA. This is epiandrosterone. So we see that its chemical composition is not complicated. It is derived from cholesterol, molecular weight 288.4, and at melting point 184.5 degrees centigrade. As I said, DHEA hydrophobic, but it is soluble in ethanol, 10 milligram per milliliter, and it is quite readily dissolved in fats and oils. Concentration of the DHEA sulfate is reduced in older age to quite low amount. So we see peak, it is like here, it is average, of course. Serum DHEA concentration is 380 microgram per deciliter, and it drops to level or into age of 70, it drops to below 100 microgram per deciliter. So it's really dropping a lot. So half-life of DHEA estimated to be 15-30 minutes, whereas the half-life of DHEA sulfate is much longer in blood, in about up to 7-10 hours. The metabolism of DHEA and DHEA sulfate typically occurs within a specific cells such as bone, adipose tissue, muscle, breast, prostate, skin, brain, and liver. It was claimed, again, it was just claimed, it was actual opinion, supported by some research, but again, there are different opinions, again, supported by some research, that approximately 50% of total androgens in adult men may be derived from DHEA and DHEA sulfate. Therefore, but actually it is a wrong opinion. Therefore, DHEA was presented as an attractive form of hormone replacement therapy to increase level of testosterone. Again, it was later on demonstrated that level of testosterone with the modest supplementation of DHEA is not improved. So, but what is yet good is that it prevents bone loss. It is helps to avoid sarcopenia, increase muscle growth. So, because DHEA has been considered as androgen synthesized by adrenal cortex, a precursor of sex hormones and neurosteroid, it is in many countries it is prescription only drug, and it is banned substance in sport. Again, this is based on wrong opinion that the DHEA is producing testosterone eventually. No, it's not so. Meanwhile, it was demonstrated, it was shown that DHEA oral ingestion in doses 50 milligrams 3 times a day does not enhance serum testosterone concentration in young men. Also, serum concentration of free and total testosterone, estradiol, and liver transaminases and lipids are not affected by supplementation of DHEA. So it is not increased. So DHEA is not actually, at least in modest amount, is not used to produce testosterone. It is proven in experiment. So we see here that the way it is cholesterol, it is used to produce pregnenolone. This pregnenolone is considered as hormone, and then in quite complicated way, it can go to produce DHEA through the pregnenolone, and then other precursors of testosterone, and also the female sex hormones. But it's actually, again, it was shown that it is not so easy, and there is no direct conversion of DHEA to testosterone. And here, dihydrotestosterone, it is more active part of the testosterone. But nevertheless, DHEA supplementation gives some possible benefits, and for those who understand, okay, it is increased libido. Well, it is right, but again, it is not related to testosterone. Better brain function. Yeah, it is clear mind, better sense of well-being. Yes, indeed. Muscle strength and hypertrophy with intensive resistant exercise. It has to be understood that without exercises, without progressive overload and fatigue, muscles will not grow. To grow muscles, you need not only supplementation and good protein-rich food, but also the exercises. And DHEA helps, but it helps not directly. So it improves bone density. Of course, if you go to resistant exercises and go it properly, the bone density will grow. Yes, but not directly. Again, DHEA don't increase the bone density directly. Okay, burning fat and increasing lean muscle mass. It is, again, we consider this later. It works so. It has some mechanism, but again, it has to be considered how to do it. It is reducing blood pressure. Okay, that's again, it's coming from resistance exercises and endurance exercises. Side effects considered minor. Facial and body hair growth in women if supplementation is in excessive amounts. Acne and oily skin, okay, maybe, and heart palpitation. If the dose is too high during the exercises, can be heart palpitation. It is should be careful to take not too much DHEA. Meanwhile, DHEA reducing inflammation, improves insulin sensitivity, blood flow, cellular immunity, body composition, bone metabolism, sexual function, and physical strength in frailty, so in old age, and provides neuroprotection, improves cognitive function and memory enhancement. Yes, this works. Biological actions of DHEA sulfate and DHEA itself includes neuroprotection, neurite growth, and antagonistic effects on oxidants and glucocorticoids. Okay, then yeah, it is quite yeah, that's true. DHEA supplementation decreases significantly circulating cortisol level while it is safe for the liver. This is quite important. So this is how DHEA improves cognitive function and improves a sense of well-being, and so it is really work. DHEA has been reported to have beneficial effects on diabetes mellitus type 2 and obesity in animal models, as it is increasing not only insulin secretion of the pancreas by the pancreas, but also insulin sensitivity in the liver, adipose tissue, and muscle. DHEA supplementation has no effect on blood glucose level. Again, so it has some beneficial effects, but not direct. It is not changing blood glucose level, but what it is happening, it inhibits conversion of glucose to fat. So with DHEA supplementation, 50 milligrams per day for 2 years, Abdominal fat significantly reduced in elderly men, while insulin sensitivity has been improved both in men and women. Okay, so again, here it has to be considered that DHEA supplementation itself, it is okay, it is beneficial, but better to combine it with some exercises. While doses of DHEA in range from 10 to 1,600 milligram per day have been reported in clinical trials, a dose recommended for an elderly man by producers is limited to 150 milligram and 50 milligram for women, for elderly women. DHEA dissolved in alcohol or fat, and it is claimed that the bioavailability is increasing 2-4 times, so absorption go 2-4 times better than if you take DHEA as powder in capsules. So mind to take your dose correctly. So if you dissolve it in fat, it is bioavailability was better, and also if you take powder, it is better improved. The biodigestibility improved if you take it with food. Regular resistance exercises in young men for 8 weeks with DHEA consumption 150 milligram a day increased strength and lean body mass significantly. Resistance exercises combined with DHEA administration was more effective than DHEA administration alone in preventing muscle atrophy in elders. Yes, it is true. The DHEA itself, it is a little difference, but if it is combined with DHEA and the DHEA administration combined with resistance exercises, then it is working very well. Okay, we'll check this how the mechanism works. The dose 100 milligram per day for middle-aged men, there were no significant changes in muscle mass and body fat in comparison with the placebo group. Again, if you just take powder or supplementation dissolved in fat or whatever, it is not helpful much. So it is not producing changes in the muscle mass and body fat. No pain, no gain. Okay, this is the rule. However, consumption of 1,600 milligram DHEA per day for 28 days substantially decreased body fat and increased muscle mass in normal men, while serum total testosterone, free testosterone, estradiol, and estrogen levels did not change. Again, we see that supplementation DHEA, even at super high doses, 1.6 gram per day and per month, it is not increasing the level of testosterone, but yet we have some good results. So the fat in body decreased and the muscle mass increased, and we can talk about mechanism why it works so. The longest placebo-controlled randomized double-blind study in older men was 75 milligram per day, and women 50 milligram per day, were done for 2 years. So it is possible to use it for quite a long time. In women, DHEA and estradiol can be converted to active estrogen. Theoretically, yes, it can be converted, but yet it is questionable. Can be converted or not? So, and to testosterone and other this active form of the testosterone, it is DHT or dihydrotestosterone, active form of the testosterone in men. DHEA supplementation may be effective for increasing testosterone level. Also, the magnitude varies is higher in females compared with to men with doses above 50 milligram a day. Okay, so if testosterone level is really low, elders and women, elderly women, yeah, it works. Testosterone level increased, and also some body mass index decreased significantly. after DHEA administration in elderly women. For elderly women, as if testosterone level itself already very low and own production is so low, then it can be we can see difference, but not for middle-aged men and young men. It is not working. DHEA which has fewer side effects than testosterone, is generally well tolerated. Minor side effects including edema, facial hair growth, acne, seborrhea have been observed in both men and women. But unlike of testosterone, no significant prostatic adverse effects of DHEA were observed in elderly men. However, most of studies revealed many minor or no positive effects from DHEA supplementation alone. So, taking a DHEA supplementation alone without resistant exercises or endurance exercises, it just doesn't work. Only when DHEA was combined with resistive exercising, 50 milligram daily, and weightlifting exercise, muscle mass and strength of muscles in elderly people was enhanced. So this is again, the DHEA is helpful, but it has to be, it is not a magic pill. Contrary to marketing claims, researchers up to date indicate that the use of the supplementation of all these pro-hormone supplements, including DHEA, including androstenediol and androstenediol and other steroid hormone supplements, do not produce either anabolic or ergogenic effects in young men if doses are not higher than 150 milligram per day. Yet again, so some moderate doses which are recommended by producers, up to 150 milligram a day for men, for young men, no change, no testosterone is not higher. Yet DHEA supplementation for no longer of 2 years and in low doses, that 25-50 milligram per day for women and 50-100 milligram per day for elderly men can be beneficial. Again, it can work. DHEA can work, especially in older age, because level of serum DHEA sulfate is dropping a lot. So this supplementation can be beneficial, but it has to be considered that it has to be together with resistant exercises. And weightlifters who certainly do very heavy resistant exercises, they take 500 to up to 1,200 milligram of DHEA a day. So I didn't find what is the result, but we can talk about this. Yeah, it is really has not direct improvement in the muscle mass. Insulin-like growth factor 1, IGF-1, is a key growth factor that regulates both anabolic and catabolic pathways in skeletal muscle. This IGF-1 increases skeletal muscle protein synthesis and reduces protein breakdown, leading to hypertrophy and muscle growth. This IGF-1 also benefits muscle growth by activating specialized muscle cells called satellite cells. These cells fuse with the muscle fibers to produce new myofibrils and muscle cells. Endurance exercises and resistance exercises of increased intensity and volume also stimulate satellite cells. Again, we have to consider how to activate this satellite cell. DHEA itself is not working, but it works again not directly that by activating all this insulin-like growth factor. But what we know that growth hormone is considered the systematic regulator of the insulin-like growth factor 1 synthesis in humans. So growth hormone is really result in production of this IGF-1 in liver. A lot of this is the main reason how this IGF-1 can be produced, but and then also excess of growth hormone is associated with increased level of serum IGF-1, whereas the deficiency in growth hormone is accompanied by low serum concentration of the IGF-1. Testosterone has been shown to increase production of IGF-1 too. So it is again, testosterone helps. Growth hormone, it's very much stimulates the production of this IGF-1, but testosterone too. Next, there was strong positive correlation between DHEA sulfate and IGF-1 levels. This data are consistent with the hypothesis that declining DHEA sulfate production with aging contributes to lower production of IGF-1, and then supplementation with DHEA can be beneficial in old age of humans, right? And then again, that together with other method, or to activate satellite cells and other methods to activate cells in bones, then with resistance exercises and endurance exercise, DHEA supplementation is very beneficial in old age. For young and middle-aged men, DHEA supplementation with doses below 150 milligram per day don't increase substantial level of testosterone, what demonstrated many times. There is no direct conversion of DHEA to testosterone, but in combination with resistant exercises, it may contribute into IGF-1 synthesis, and therefore it can activate satellite cells in muscles. And from my own experience, as well as references of men taking about 150 milligram of DHEA before resistant exercises, endurance gets higher, and it allows to increase intensity and volume of the resistant exercises. This is, I believe, the mechanism how DHEA helps. It helps to improve endurance, also the sense of well-being. So it is again this way, and then with this better endurance, then higher stress, fatigue, and progressive overload of muscles may activate satellite cells and result in muscle hypertrophy. So DHEA alone is not so efficient to activate satellite cell, but together with high intensity resistant exercises and endurance exercises up to fatigue and failure, then it is activating and make very good results. DHEA produces a sense of well-being without adverse effects in 70 or up to 80% of patients, according to quality of life assessment. Oral administration of DHEA at a daily dose of 50 milligram to elderly men for 20 weeks resulted in a 20% increase in serum, or this insulin-like growth factor 1. DHEA supplements improve wound healing, mood, bone remodeling, and physical well-being, psychological well-being, sense of psychological well-being. Again, DHEA works through this activation, the production of the insulin-like growth factor 1, and then with high amount of the IGF-1 in blood, and then we have higher wound healing, etc. DHEA supplementation may increase serum insulin-like growth factor 1 levels, especially in women and older subjects, because they have already very low level of this IGF-1 with dosages above, but what was used, dosages above 50 milligram a day, and intervention longer than 12 weeks. So it helps, but again, it takes time. And again, I have to remind you that that growth hormone is the main factor to increase serum concentration of insulin-like growth factor 1, and then it is actually equivalent DHEA supplementation together with resistant exercises is work the same way like growth hormone. Additionally, DHEA supplementation causes a nitric oxide release in aortic endothelial cells independently from hormones estrogen and androgen receptors. Yeah, okay. It was found that the relaxation of blood vessels induced by DHEA was partly dependent on the endothelium, and this effect was mediated by either with hydrogen sulfate and nitric oxide. Okay, so we see that again, if you take DHEA before the exercises, the blood circulation improves, this endurance improves, so it is again related, endurance related to blood circulation, and altogether it is very helpful to activate satellite cells and activate other growth factors. It works almost the same like growth hormone. DHEA improved insulin sensitivity, which directly affects the anabolic efficacy by increasing the absorption rate of amino acids in the skeletal muscles. Again, we see that DHEA helps to increase the muscle hypertrophy, muscle growth, muscle bulking, and then it is again work together. So it improves circulation of blood, it improves the supply of the amino acids to the skeletal muscles, and then we go through the progressive overload, higher stress to skeletal muscles, and it results in muscle hypertrophy. DHEA activate activity in the brain regions associated with generation of negative emotions and enhances activity in regions linked to regulatory process. In animal models, DHEA and DHEA sulfate administration reduces depressive and anxiety-like behavior, as well as produces enhancement of memory and executive functioning. In large community samples, serum DHEA sulfate is positively associated with performance in attention, concentration, processing speed, and working memory task. Okay, so it helps very much to brain to work better. High level of plasma circulating DHEA sulfate are suggested as a marker of human longevity. A specific intranuclear receptor for DHEA has not been identified. It's okay. This is why it doesn't work directly, but through this insulin-like growth factor, etc. So, but yet again, highly specific membrane receptors have been detected in endothelial cells, the heart, kidney, liver, and the brain. So it is working. It's not directly, but it works in many different ways. Research shows that DHEA and DHEA sulfate, as well as their metabolites, have a wide range of effects on numerous organs and organ systems. DHEA can be used in the treatment of depression and associated cognitive disorders. Okay, this publication. DHEA can be used as anti-aging agent for skin. Yes, for skin, for topical application. Topical DHEA, because it's dissolvable in fat, so it is 1% in a vehicle, tends to improve skin brightness, to counteract papery appearance of skin and epidermal atrophy, which is that is a characteristic feature of hormone-related skin aging. Topical DHEA could also act on skin process related to wrinkles, but this result remains to be confirmed. Okay, so it is improving synthesizing of collagen, so it is quite good. Okay, so and DHEA in higher concentration, 5% in ethanol and emulsion, olive oil in ethanol, 1 to 2. Increased pro-collagen synthesis and inhibited collagen degradation. Okay, so it is not reducing, it is not reversing the aging, because aging, to my opinion, the main factor of aging is this cross-linking of collagen with glucose and fructose. but yet it can give some impression of younger skin and less wrinkles. So regular intake of DHEA results in pronounced sense of well-being without adverse effects, markedly increases endurance if it is taken before endurance exercises and resistance exercises. Therefore, it allows to increase intensity and volume of the exercises and eventually accelerate growth of muscles. DHEA inhibits the conversion of glucose to fat and therefore decreases appetite in people eating carbohydrates. Most of elders may benefit from DHEA supplementation. For young and middle-aged people, intakes has to be started from 50 mg for men and 25 mg for women, with slow increase of the doses while monitoring health and possible side effects. Again, for young men, probably the supplementation of DHEA can give additional sense of well-being, and again it improves a little bit the endurance. So it is, but yeah, again it's for elderly it is quite visible, that quite obvious that DHEA supplementation is helpful, but for young men it's probably not much. What I want to also to talk about pregnenolone. Pregnenolone is a precursor in biosynthesis of DHEA and most of other steroid hormones. Check this scheme that how cholesterol is converted to this hormone precursors and hormones and sex hormones. It is produced in the brain from cholesterol. Again, so cholesterol is important part of our food, and increase in the cholesterol content in food is very, very beneficial. So eggs are the best food what can be used, and eggs have, one egg has 180 milligram of cholesterol. It is very much recommended to eat as many eggs as possible, good quality eggs. Okay, but whatever. Pregnenolone improves cognitive function and was used as anti-aging dietary supplement, nootropic and medication since 40s. So long history of its use. Yeah, it is. So the people take this pregnenolone, and because it has long history of safe use, and in doses 20 to 50 milligram per day. In clinical trials, pregnenolone is typically prescribed at 100 milligram a day, and in research setting, doses up to 700 milligram are reported. But again, pregnenolone is a precursor of DHEA. I believe that supplements of DHEA it's more easy and actually cheaper, because not so easy to buy pregnenolone. DHEA production is well established and relatively inexpensive. But as I said, in difference to DHEA, distribution of pregnenolone is not regulated, so it is more easy to buy the pregnenolone. Supplementing DHEA and pregnenolone together is not recommended. You have to decide what to do, this or that. Pregnenolone is nootropic. It improves memory, it improves sense of well-being, the same like DHEA, maybe in higher amount. I didn't try myself, but okay, I make this video because I want to understand what doses of DHEA I have to take, what would be side effects, what would be the procedures, so and the time to take this. And again, but it is not recommended to take DHEA before bedtime, because then insomnia can happen. So again, I recommend it to take before intensive exercises, and because I go to gym or for this intensive exercises not every day, then I don't recommend it to take it every day, only before the exercises. Only such way the DHEA will work, because it will increase the production of insulin-like growth factor 1, but it works together with fatigue and with this failure in repetition of the muscles and muscle training, and also in progressive overload. So you have to do it everything properly, then you will see results, how the muscles will grow. And what is again important, mind that you need high amount of protein to grow muscles, and you need some, we'll discuss later on, good relaxation, good rest time to recover after the intense exercises. And we need cholesterol. Mind that there is no bad cholesterol. Cholesterol is substance. Cholesterol, there is no high density cholesterol. It is wrong. Cholesterol is cholesterol. What the medical professionals call high good cholesterol, it is not cholesterol. It is low density lipoproteins, completely different completely different substances, completely different. Cholesterol is present in there, but to stabilize membrane, but also cholesterol stabilize membrane in all our body, and we need a lot of cholesterol. The more cholesterol we can consume, up to maybe 5 grams per day, the better. It is DHEA would be beneficial, but will not replace the good portion of cholesterol. So the animal fats and eggs and seafood are the good sources of cholesterol. Okay, thank you for your time to watch this presentation. Please mind that I am not medical professional, neither I am experienced athlete, so therefore my personal opinion cannot be used as medical or professional advice. Instead, it is recommended to discuss the information provided with this information with your personal physician. I will never do it because physicians understand almost nothing, sorry to say. So what I use is, you see, I use the scientific publications. I give references. If you download presentation, you can click on the reference, you can learn more. This work is absolutely important. If you understand what you are doing, how that you use the supplements not blindly, but with understanding how it works, it is much more helpful. Okay, that's all. Thank you again for your time. Ciao.